This is Dr. Lowe. How are you kitties doing out in Playland?
Okay, this is Dr. Lowe with Kids Arthritis Care, and this is something new we're going to be trying on Fridays, where you can tune in and ask Dr. Lowe questions about anything arthritis related or rheumatology related. Just to get the conversation going, Dr. Lowe will be talking about flat feet and what that means and when he sees it and things to be on the lookout for. Do you want to start?
Sure. So flat feet is something that's very, very common. And a lot of people who are double jointed, which means the medical term is hypermobility, because they can move joints farther than other people can. And you know this when you see your kids doing the pretzel thing with their arms behind their backs and all sorts of things like that. Well, it so happens that the bottoms of their feet also are the tissues are arranged more loosely. So they have nice arches, but then when they step down, their arch goes away and their ankle rolls inwards. And so we call this, the medical term is Pes Planus. I have no idea what kind of Latin term would correlate with flat feet, but that's what it is. But it's flexible Pes Planus, meaning they weren't born with rocker bottom feet, and this isn't a congenital abnormality. It just goes with being hypermobile, and some people that aren't hypermobile have flat feet. But you know it if you look at your ankles. If you have your child stand without shoes or socks on, and you stand behind them, if you see that their ankles are rolling inwards when they step, then that means that they have this flat feet. A lot of kids don't have any problems with it for some reason. Kids, when they get closer to adolescence, to being teenagers, they start having more problems with it because probably because they're putting on more lean mass, and there's more weight, so there's more weight on that's causing their ankles to pronate, to bend inwards more.
So how common is this in children?
It's probably anywhere from 15 to 30%.
Of all children?
Yep.
And how would a parent know just by watching them walk?
Right.
It's a gait?
No. The way that most parents know is because they have flat feet themselves, and they've had pain and they've had to get arch supports. So if parents have flat feet and are using arch supports, then look at your kids' feet, because that's who they inherited from.
So what are the symptoms?
So the symptoms can be something as simple as ankle pain, because but what a lot of people don't understand is that because when the ankles are pronating or rolling in, you can actually have foot pain, ankle pain, knee pain, hip pain, and some people even have back pain, because it kind of throws off the alignment of their bones, because their ankles are rolled in, and it changes the angle of their bones and even up to their hips. So I've had plenty of patients who have had pain for a couple years, and but they never have any swelling in any joints, and they finally make it to see me, and they don't have any signs of arthritis, but they do have pain, and so I recommend getting these arch supports, shoe inserts, because most shoes now are not made with any arch support whatsoever, since shoe manufacturers are spending all their development money and design on the outside of the shoe, so you're really only buying 3/4 of the shoe now. So now, in order to get the proper arch support, you've got to buy the other quarter of the shoe, which is the arch support, the insole. So you can go to a running shoe store, or any shoe store should have them, but oftentimes smaller shoe stores, athletic shoe stores, will have better trained staff that will help make sure you get fitted. And so you just take out the insoles out of the shoes that you have, and then you put these in. And probably one of the most critical aspects of it is to not try to wear them all day the first day that you have them. You need to work up to it, or else your arches, the bottoms of your feet, will hurt very, very badly. So you wear them for an hour the first day, and then 2 hours the second day, and 3 hours the third day, and you just work up 1 hour per day, and that gives your arches a chance to get accustomed to them, and then you won't have the severe foot pain that can happen to anybody if you wear arch supports with sufficient arch support from not having any arch support.
And then you wear them all the time, or just for a
Yeah.
certain amount of hours per day?
Ideally, you should wear them all the time. I tell parents that, or kids, that if they are at home during the weekends and they're not going out much, and if they're walking around barefoot or in socks, they're not having arch support, so they are having their ankles roll in.
Oh, go ahead.
And that they can probably try either putting them in slippers, arch supports in slippers, or they can get some shoes that are just indoor shoes that they can put them in that they can wear around the house, so they have arch support.
Okay, so we have a question.
Okay.
The question is it better to walk a long distance in poor shoes or with no shoes?
Neither. You should try to walk with proper arch support. It depends on your arches whether or not it's going to be more of a problem. My guess is both things are going to cause pain, and to different degrees depending on the shape of your arch and if the design of the shoe that you have, if it doesn't have any arch support. So I'd recommend not doing either, but certainly walking with shoes if you're going to burn your feet or step on glass.
So if you have a child with pain and no swelling, do you recommend them trying the inserts before coming to see you, or?
That's a very reasonable approach. There's a lot of misunderstanding about arthritis because 90% of adults with arthritis have osteoarthritis, which is not really autoimmune, meaning it doesn't involve their immune system attacking their joints, but it's degenerative, where they've worn out their joints over time and the cartilage is worn down and they have a lot of pain, and that is called arthritis, but it's osteoarthritis. Kids don't get osteoarthritis because they haven't been around long enough to damage their joints. So kids get inflammatory or autoimmune arthritis, so that involves swelling. So kids, if they have pain in joints and without any sign of any swelling in that joint, it's actually a negative predictor of having juvenile arthritis, because normally kids only get the pain when there's enough swelling to press on the nerves that cause the pain. So in other words, if you have pain in joints and there's no swelling and there's no stiffness in the morning for more than 30 minutes, it's very likely what we call mechanical pain. Doesn't involve the immune system attacking the joints, but has to do with the way the tendons and ligaments are being strained, or flat-footedness, or other things like that that can be treated with arch support shoe insoles or physical therapy. So yes, it's very reasonable to try physical therapy or arch support shoe inserts before going to see their rheumatologist if the only symptom is pain and there's no joint swelling.
Rosie, do you have any questions? Is there anything else you want to cover, Dr. Lowe?
I think that's it for right now. But if anybody has any suggestions for topics that they'd like me to discuss in the future, then please let us know, and I'd be very happy to talk about that in the future.
Great, thank you.